Indacaterol is an inhaled long-acting beta-2 adrenergic agonist used to relax bronchial smooth muscle and improve symptoms and airflow obstruction caused by chronic obstructive pulmonary disease, COPD, and moderate to severe asthma. In this video, let's find found. What is Indacaterol? What is Indacaterol used for? Contraindication. What are the side effects of taking Indacaterol? How does Indacaterol work? How to use Indacaterol? What is Indacaterol? Indacaterol is an ultra-long-acting beta-adrenoceptor agonist developed by Novartis. It needs to be taken only once a day, unlike the related drugs formoterol and salmeterol. It is licensed only for the treatment of chronic obstructive pulmonary disease. What is Indacaterol used for? For the long-term, once-daily dosing maintenance of airflow obstruction in patients with chronic obstructive pulmonary disease, COPD, including chronic bronchitis and/or emphysema. Contraindication. All long-acting beta-2 adrenergic agonists, including Indacaterol, contraindicated in patients with asthma without concomitant use of long-term asthma controller therapy. Indacaterol not indicated for treatment of asthma. Side effects. Arm, back or jaw pain. Chest tightness or heaviness. Chills. Fainting. Fast or irregular heartbeat. Fever. Nausea. Sneezing. Pharmacodynamic. Bronchodilator drugs are the foundation for the treatment of chronic obstructive pulmonary disease. The principal inhaled bronchodilator treatments used are beta-2 agonists and anticholinergics, either alone or in combination. Currently available beta-2 agonists are of either short duration and used multiple times/day, or of long duration, which requires twice-daily administration. Indacaterol is considered an ultra-long-acting beta-2 agonist and was recently approved for use in the United States. Mechanism of action. Indacaterol works by stimulating adrenergic beta-2 receptors in the smooth muscle of the airways. This causes relaxation of the muscle, thereby increasing the diameter of the airways, which become constricted in asthma and COPD. It is also long-acting due to its high affinity to the lipid raft domains in the airway membrane, so it slowly dissociates from the receptors. The pharmacological effects of beta-2 adrenoceptor agonist drugs, including Indacaterol, are at least in part attributable to stimulation of intracellular adenyl cyclase, the enzyme that catalyzes the conversion of adenosine phosphate, ATP, to cyclic 3-5-adenosine monophosphate, cyclic monophosphate. Increased cyclic AMP levels cause relaxation of bronchial smooth muscle. In vitro studies have shown that Indacaterol has more than 24-fold greater agonist activity at beta-2 receptors compared to beta receptors and 20-fold greater agonist activity compared to beta-3 receptors. This selectivity profile is similar to formoterol. Half-life. Indacaterol serum concentrations declined in a multiphasic manner with an average terminal half-life ranging from 45.5 to 126 hours. Dose. For inhalation dosage form, powder. For maintenance treatment of COPD. Adults, 75 micrograms mcg, 1 capsule, by oral inhalation once a day. Children, use is not recommended. Safety advice. US FDA pregnancy category, C. Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans. But potential benefits may warrant use of the drug in pregnant women despite potential risks. That's all the information about Indacaterol we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.